Is your significant other a noisy snorer at night? Or is that something you often hear people complain about you doing? Anybody in the room can find snoring to be bothersome. But if you or someone you know experiences snorting along with snoring, there may be a more serious issue at hand. This condition is known as sleep apnea. As is typically the case with adults, this sleeping disorder is not something to be taken lightly and should not be disregarded. Whether you've heard of sleep apnea before or are only now learning about it, it's a disorder that causes breathing difficulties when you're asleep. This illness develops when your upper airway muscles are injured during inhalation, depriving your body of a steady flow of oxygen and impairing proper bodily function. There may be consequences if sleep apnea is not treated. However, how can we distinguish between normal snoring and sleep apnea? And who is in danger? Without further ado, let's explore these and many more questions as we delve deeper into the subject. Comparing regular snoring with sleep apnea. Between normal snoring and sleep apnea. While ordinary snoring is generally harmless, sleep apnea presents with a variety of symptoms. Your airway's relaxed tissues vibrate, which is what causes snoring. The easy passage of oxygen is obstructed by these drooping tissues. However, there are instances when this obstruction agitates your body to the point where you wake up, which may be a severe enough sign of sleep apnea. Simply said, snoring is partially blocked breathing, which might be a minor annoyance to the person sleeping next to you. Not only can a loud snorer impair your own sleep quality, but it can also interfere with the sleep patterns of the individual occupying the space next to you. Generally speaking, if your snoring is occasional and caused by fatigue or obesity, you shouldn't be concerned. Contrarily, sleep apnea is far more dangerous. Frequent loud snoring and significant breathing difficulties, such as gasping and choking, are the symptoms. Restlessness is widespread and snores are significantly louder than usual when sleep apnea is present. According to a study, 100 million people globally have sleep apnea. Furthermore, 22 million Americans by themselves contribute to these figures. Around 330 million individuals call the United States home, meaning that 1 in 12 of them have sleep apnea. Remarkably, 75% of those individuals have no idea what their illness entails. Two varieties of sleep apnea exist. Apnea obstructive during sleeping. Sleep apnea comes in two types. The most prevalent kind of the problem happens when there are substantial obstructions in your upper respiratory tract during sleep, which totally stop the passage of oxygen. Your throat's soft tissue collapses, obstructing your airway completely or partially and making breathing difficult for you. The oxygen supply is restricted, which could lead to irregular heartbeats. Consequently, your diaphragm and chest muscles have to work harder to keep your airways open in order to make up for the decreased oxygen supply. This explains why, when you wake up from a slumber, you jerk and gasp. Apnea central to sleep. An unusual circumstance in which your brain modifies your sleep patterns. Your central nervous system malfunctions in central sleep apnea, impairing the ability of your respiratory tract muscles to contract and carry out breathing. These types of CNS malfunctions typically happen when the body is already going through a difficult time and dealing with illnesses of the heart, lungs, and kidneys. So how will you be able to determine whether you have this disorder? Let's say that you discover that people are often complaining to you about your snoring issue. Then it's necessary to keep an eye out for symptoms like persistent restlessness while you sleep, frequent awakenings from gasping or choking, headaches, night sweats, sexual dysfunction, mood swings that are depressed, and exhaustion during the day. Individuals suffering with central sleep apnea may also develop insomnia, or the inability to get asleep and stay asleep. How does your doctor make the diagnosis of sleep apnea after you suspect it? How does your doctor diagnose sleep apnea? Once you've determined that you have it, a relevant sleep evaluation test may be recommended by your doctor based on your medical history and symptoms. The study known as the home sleep test is conducted at home by an untrained technician. It is employed in the diagnosis of patients with mild to severe obstructive sleep apnea because of its limited function recording. This study is not appropriate for use as a screening tool for patients with serious medical conditions, such as pulmonary, cardiovascular, or neuromuscular diseases. Furthermore, no evaluation is done for other sleep disorders such as central sleep apnea, narcolepsy, insomnia, and circadian rhythm problems. Or physicians may recommend a polysomnogram. A qualified specialist is directly in charge of overseeing the performance of a polysomnogram, or PSG. This comprehensive exam provides a rather in-depth examination of how the body works when you sleep. It monitors the electrical activity of the brain and records blood oxygen levels, breathing patterns, muscular activity, airflow, heart rate, and eye movements. The assessment offers us a graded level of disruption severity, which is ideal for a precise diagnosis. Which health risks are involved? What health hazards are involved in all this? Weariness or drowsiness. It is obvious that you feel sleepy all day because you are not getting a good night's sleep because of all the interruptions. This causes mood swings and angry behaviors in addition to decreasing your performance at work. Cardiovascular diseases. Heart failure risk is increased by 140% in patients with obstructive sleep apnea. If there is a prolonged disruption in the oxygen flow, your cardiovascular system will be under pressure. Your heart must work harder to keep your body going. And when it does, it can get overworked and develop problems including heart attacks, strokes, and coronary heart disease. Type 2 diabetes. By pushing your body over the edge of insulin resistance, sleep apnea contributes to the development of type 2 diabetes. Approximately 80% of those with type 2 diabetes who do not yet have sleep apnea diagnosed. It's also normal to experience other health problems like breathing difficulties, elevated cholesterol, hypertension, and a slowing metabolism. Knowing exactly what caused your sleep apnea is helpful after you've been diagnosed with it. After receiving a sleep apnea diagnosis, it can be beneficial to know the precise source of your condition. Sleep apnea is caused by a number of conditions, most of which are preventable. Since obesity is a contributing factor in over 60% of cases of obstructive sleep apnea, it is normal for sleep apnea to develop as a result of being overweight. Smoking and the abuse of alcohol or sedatives are two more preventable causes. A study found that the likelihood of sleep apnea among smokers is 3 times higher than in non-smokers. While drinking alcohol and using sedatives won't always cause sleep apnea, they can exacerbate mild snoring since they relax the throat muscles. In addition to causing sleep apnea, smoking and alcohol consumption can lead to serious health problems in the long run. Thus, why not surrender them while there's still time? These kinds of bad habits are completely avoidable. Medical conditions that are currently present can also cause sleep apnea. Obstructive sleep apnea is more common in people with cardiac problems, type 2 diabetes, high blood pressure, and Parkinson's disease. A number of other variables, including age, family history, and nasal congestion, are also important in the development of sleep apnea. How do we treat it now? How do we handle it now? In moderate circumstances, your physician might advise you to drastically alter your way of living. Keeping up a healthy weight through exercise is one of these lifestyle treatments. If you gain back any weight, it could lead to a recurrence of the ailment. Another great workout technique to help with sleep apnea is yoga. It assists you in honing breathing exercises that raise your oxygen saturation levels. Additionally, physicians may recommend bilevel or continuous positive airway pressure therapy, CPAP, for moderate instances, BPAP. A mask that must be worn during night is used to deliver CPAP. The upper respiratory tract is then supplied with high-pressure air, which helps to facilitate oxygen input with few or no obstructions in the path. When CPAP therapy proves to be ineffective, BPAP is employed. The two pressures that are used by BPAP machines are the pressure during inhalation and the pressure during exhalation. When all other options are exhausted due to the severity of sleep apnea, surgery is typically the final option. All that sleep apnea is a problem caused by the choices we make in our lifestyle. Thus, make time for your well-being and avoid such stressful circumstances. Get moving, consume healthfully, rest well. Are you unsure of any other physical warning indicators that you should pay attention to, or would like additional information about wellness? Keep checking back with our channel to delve further into the vast array of fascinating body-related subjects. Observe 16 indications that your blood sugar is too high, 8 symptoms of diabetes, or 9 indicators that you may be deficient in vitamins. Feel free to click one. Better yet, watch both to get more knowledge about maintaining your health and fitness. How often do you snore? Consider yourself to have sleep apnea, perhaps. Tell us in the comments section below.